OneWorld has been making a difference for 45 years, and they pay special attention to people who are underserved.
That includes different programs or services, and now a whole center.
Alyssa Watts works in OneWorld's Teen and Young Adult Health Center. It's as an adolescent outreach coordinator is essentially your title, isn't it, Alyssa?
Yep.
Yeah, well, thanks for stopping by this morning. Before we get to the center, I want you to touch on World AIDS Day. That was earlier this month, right?
Right. December 1st was World AIDS Day, celebrated every year. And it's really important to focus. You would think that with all of the medical advances in the past several decades in the fight against HIV, that we would see sort of a decline, a significant decrease in the number of new HIV cases.
We're not seeing that, though?
It's just not really the case yet. There's still a significant number of new cases each year. And so you really want to refocus on HIV is still an issue. It's still something that we need to be cognizant of and thinking about how do we combat that.
Is there just not enough attention put on it, and maybe through the media or other sources? And I guess that's part of the reason why they have World AIDS Day.
Sure, World AIDS Day draws attention to the fight against HIV, but also there's a lot of stigma around HIV testing and treatment, and people attached to people's bodies around HIV. That prevents people from getting the care they need, from taking as good a care of themselves as they could, that makes people feel that they can't get tested, and so they go around not knowing their status for a long period of time.
And so what is OneWorld's role in helping to prevent the spread of HIV?
OneWorld currently, as an organization, does a number of things. We're always looking to partner with other organizations in the community to better serve people who need to get tested, need to get treatment, and do that at a cost that they can actually afford. But right now, some things that we're doing that are pretty exciting. We've started transitioning to a more rapid test, which is a little bit of a transition for us from the old blood draw test that takes several weeks to get back. Sometimes it takes people a while to get to their results. That rapid test, they get the results that same day,
wow,
which is amazing. We've also put a lot of effort on just destigmatizing STD testing and making it part of people's routine, talking to people about it more regularly, and especially young people who are probably most fearful of getting tested, of approaching a healthcare provider when they need that testing.
And those young people, that's a group that you really want to reach out to. And so you've got the new Teen and Young Adult Health Center. And how does it support those efforts that you're trying to combat right now?
The Teen and Young Adult Health Center, which will be opening up for our first patients at the beginning of January, and our grand opening will be January 26th. We're super excited to start seeing teens at that new health center because it's a flexible approach. It really looks at what is it that teens need. They don't need necessarily appointments early in the day when they have to go to school still. They need appointments later in the evening when they have the time available. They need a health center that's maybe walking distance from their school, so we are walking distance from South High.
So you said teens and young adults. What is there an age limit?
The upward age at this point, we're looking at 24. That's probably a little bit flexible still, but trying to capture that transition from being a young person, totally dependent on your parents, to being an adult and sort of feeling independent, able to manage your own healthcare, and then transition out to family practice.
And one of the things when I've read about this center is you're building this to be totally unique, different than other centers that are out there. How so?
Just the approach that we're taking with it, like I said, with the transition from being an adolescent dependent upon your parents to being a young adult who can advocate for their own health care, a lot of what we're doing is to try to support young people in that journey. So giving them a chance every time they have a visit to have one-on-one time with a provider and say, what is it that I need to do? How do I navigate this system? Talking to them about things like their own health and how to make healthy choices, giving them the information they need to make good decisions about their health care.
Does it help or hinder you when there is a national story, say, with an athlete or an actor? Because I could kind of see both sides. I would think maybe it raises the flag of awareness again. Does it help or hinder what you do?
Probably.
You're talking about Charlie Sheen.
Charlie Sheen.
Charlie Sheen coming out, yeah.
Right. It helps and it hinders. It helps because it puts the spotlight back on the struggle of individual people and makes it a humanized story about HIV, but it also hinders because then there's all of the backlash and all of the negative things that you hear people saying about Charlie Sheen and about other people who've come out as HIV positive. It's good that people are talking about it, but it's not always great that people talk so negatively about individual human beings who have lives.
Yeah,
Right.
It's that whole awareness that you speak of. OneWorld Health comes on the show all the time, and it's there's a broad range of services. Can you speak about some of those? What sort of services do you offer, just for everybody out there that's maybe looking for something?
Right. We offer a full range of healthcare services. We're a patient-centered medical home, so that means we really try to treat the entire person. We have integrated behavioral health. We have dental at several of our locations. Our new Teen and Young Health Center won't have dental because it's a very small little operation that we'll be running there, but we will still have integrated behavioral health. So whether you're coming in for a medical visit, you're coming in for a behavioral health visit, you'll be able to get your needs addressed that day.
Yeah, OneWorld Health. Of course, we know of the big building down, this the livestock
The
exchange
livestock
building
building,
down
yeah.
there, but you have several satellite clinics around the metro area that you can really check out. So you just go to the website, oneworldomaha.org, and check out all the different services. And of course, you got the opening of the new teen and young adult health center that's coming at the beginning of January. Alyssa, thanks for stopping by. We appreciate it this
you.
morning.
Thank
Yeah, have a
you.
good holiday.
Thanks.
All right, next, the story behind those chips in our new debit and credit cards. What's the technology? What's it designed to do?
It's good stuff. Comedian John Morgan will join us at 9:36. Why it's buckle up and hold on when he's on the stage.
Hang on tight, that's right.